back to these trends. So the viral collagen overnight masks that seem to be absolutely massive. They're everywhere. There's dermatologists from the US with them on their faces. Are they a thing? Are they not a thing? What do you think?
So I think the collagen mask in and of itself is certainly something fun for patients to do. It's something that can confer short-term benefit. I think the biggest problem with it is its name. So it's called the collagen sheet mask. So automatically patients will assume that they're going to boost their collagen levels and they're going to have this wonderful long-term benefit from regular use of these masks. The thing to understand is that the collagen, they use sort of these hydrolyzed collagen molecules in the mask. They impregnate them with collagen as in addition to a whole lot of other ingredients, so niacinamide and various other products. But they're using the collagen there as a humectant, so something to draw moisture to the skin. So what happens is you put it on for whatever it is, 4 to 6 hours, then you peel it off. There are a number of things that will happen. One is that your skin is full of hydration. So it's very plump looking, it's beautifully smooth, and it's glowing. So you look fantastic after them. There's no doubt about that. The idea, however, that it's somehow going to stimulate your own collagen for a prolonged period of time is there's no science there, right? So it's all about short-term hydrating benefits, anti-inflammatory benefits, which, you know, in the long term is anti-aging, but mostly hydration. And I do think there's something to be said about that occlusivity that kind of really helps maximize how much hydration. And when you peel the mask off, you're getting a slightly exfoliating effect as well. So there's this kind of, you know, beautiful glow that you have after them. And if you want to, they're not terribly expensive. So I have no issue with patients, you know, doing that. But again, it's short-term benefit.
But it's not putting collagen into the skin, because that does not make sense.
Exactly right.
Yeah. Okay. So another one that my daughter talked to me about was icing your skin. What's your thoughts on icing your skin?
Yeah, so again, this is something I spoke about on a television show called The House of Wellness, because it became really popular in COVID and there were so many different TikTok videos about it. So again, it's this very ancient technique of simply applying something very, very cold to your skin, whether it's ice blocks, whether it's like the gua sha rollers, whether it's something that a mask that you've frozen. Icing will help cool the skin, and in cooling the skin, it's naturally anti-inflammatory and it's soothing. There are risks. You definitely don't want to apply ice neat to the skin and cause frostbite or, you know, a thermal injury through excessive cold. But it's going to help reduce swelling, and it will be, as I mentioned, anti-inflammatory. So it can be helpful, but again, temporary. You're not going to see long-term benefits for it. So I think if you're naturally someone whose skin is inflamed, is swollen, is upset or angry, applying anything cool to your skin will give you temporary relief, a reduction in swelling. But yeah, don't expect it to be giving you, you know, that beautiful glass skin long term.
Yeah. Okay. Amazing. And what about those facial rollers that have got all the little pins or needles in them? I have to say I'm not a fan, but I would love to know what your opinion is on those. Yeah,
so again, I agree. So I think they're very well marketed. So derma rollers is one thing, and then you've got the actual sort of jade rollers, which is another. You see a lot of funny videos online with patients using those or people using them. I say proceed with caution, particularly with derma rolling. I think if your skin is sensitive, if you're using a variety of skincare actives, you can actually be causing a whole lot of inflammation by causing micro trauma to the skin through derma rollers, and expecting it to really help your skin, but it could be doing the opposite. So I think use it under medical guidance or with medical advice rather than just going out online and purchasing derma rollers. I think the jade rollers really do minimal, so I never recommend them. I think they're fun to do, but I can't see them actually.
It's maybe relaxing, but that's about
exactly.
it.
Yeah, nice little facial massage.
Ryan, I know that you're someone who's really at the forefront in dermatology. Is there any kind of new research that would be exciting to share? I don't know, on acne or rosacea or anything that you feel like is really going to really change the face of what we do with our skin?
I think there's new research coming out all the time. That's super, super interesting. If you think about acne, where we're learning much more about the microbiome, which we talked about earlier, and the fact that there are not only Cutibacterium acne, which is what the new name for P. acnes that everyone's heard about, but we know that various strains of Staphylococcus aureus or golden staph are very relevant. And this is where good skincare that can address the microbiome can be quite helpful. As you know, Shauna, we've got a lot of research now coming out in the benefit of particular lasers for acne. So 1726 nanometers is the wavelength that we know is very specific for the sebaceous gland. So we're using laser-based technology now based on good research to help clear acne without necessarily relying on old oral medications. So I think this is a really bright space. I think we're seeing a huge influx of good energy-based devices for skin where we've always relied on medicine. And I think we're seeing a change in the community where people don't necessarily want to take medicine anymore. They don't want to have to rely on pills every day. I certainly, if I were a patient, I'd be exactly the same. So I think it's nice to be able to provide patients with evidence-based therapies that don't rely on, older oral therapies.
And those newer therapies for acne, are they painful or how do people tolerate it?
Yeah, so a lot of the lasers can be a little bit spicy, but it's all about having a really good pain protocol. So we have, at my own clinic, we very much encourage patients to take some Panadol and Nurofen before they come in. We can use topical anesthetic gels, and if really necessary, we can block nerves to help them kind of cope. But I think the vast majority of patients will say, look, it wasn't the most comfortable procedure, but I'm very happy with the results, and they'll do it again. And that's the most important thing, is that would they actually go through this process again for the results that they achieved? And overwhelmingly, the answer is yes.
I think you and I both know it's the psychological side effects of skin conditions are absolutely massive, and just seeing people's confidence both be absolutely destroyed but then hopefully being rebuilt when you actually change their skin, it's quite remarkable.
Yes, it's probably one of the most rewarding things that I do, is seeing patients come in very upset, down, depressed or anxious because of their skin condition, and being able to help them on their journey, and then seeing the impact that it has not only on their confidence but on their whole self-esteem and their personal and professional lives. It's so fulfilling.
Okay, ladies, get your diaries out and mark the date. On the weekend of Friday the 30th of May to Sunday the 1st of June, I'm inviting you to join me at the Quarters in Foresters Beach for our first ever She Thrives retreat. Designed exclusively for women aged 35 to 60, experience expert-led workshops, yoga, luxurious wellness treatments, and access to premium facilities with saunas, cold plunge, and more. Enjoy gourmet meals, fun evening entertainment, and take home a goodie bag worth over $500 while connecting with like-minded women. To learn more, head to you.drShaunaWatts.com.au. I hope to see you there. This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or other professional advice. Information is provided for educational and entertainment purposes only. If you have any health concerns, always consult your doctor.